Hi, this is Saurabh Kochhar,
Hi, I'm Dr. Isha Narang.
and today we talk about the lesser talked side of dermatology.
So these are the conversations that we should be having, but internet forgot to make it viral.
Exactly. We all know the skincare ingredients nobody can pronounce. We have made Korean skincare viral, but we've somehow forgotten to talk about skin cancer in India. Also, we have here Dr. Isha with us, who's a globally certified dermatologist who specializes in skin cancer. And Dr. Isha, as a run up to this, we did a lot of research, or I tried to do a lot of research on skin cancer. कोई videos मिल जाए, कुछ सामान मिल जाए. Nothing is available. Why do you think is that?
So this works both ways. So Indian skin type is brown skin type. We do have a lot of melanin in it, and thankfully it protects us from skin cancer. So in general, skin cancer is quite rare in Indian skin type. And so even dermatologists are not aware how to diagnose and treat this condition. And that's why in Indian scenario, this is considered to be a rare situation, so nobody talks about it.
But I think it starts with knowledge at the end of the day, right? So I don't even know if I'm getting a spot. How do I detect whether it needs help or not? How do we get started with this?
So for that, self-monitoring is really important.
Yes.
You know your skin better than anyone else. So self-monitoring, self-skin check is really important to identify anything that's changing in your skin or any changing moles or lesions.
But matlab, how do we get to know? Because see, it's easy for you to know it as a dermat.
Yeah.
As a layman, how do I know, okay, this is what I'm looking for?
Yeah, so there's a rule for that. That's called as ABCDE rule to check a lesion or a mole. So A stands for asymmetry.
Okay.
So if you divide a mole into 4 quadrants, all 4 quadrants should look similar. But if you feel like one quadrant is standing out than the other, the mole doesn't look symmetrical, then that's a red flag.
आड़ा टेढ़ा अगर
Yeah.
अगर मैं
Yeah.
हिंदी भाषा में बोलूँ,
Yeah.
ओके फाइन. आड़ा टेढ़ा ना हो, अगर वो थोड़ा सर्कुलर सा है या कोई वेल डिफाइंड टाइप का है, then what you're saying is okay. But if it is asymmetric, that's the first red flag.
Yeah.
Okay.
The second one is border. So the border should be well defined, okay? But if you feel that the borders are fuzzy or hazy, and it's blending into the margins, then that is a red flag.
Okay.
C stands for color. So a mole or a good benign mole, benign means not cancerous. A
Okay.
benign mole should, have one color throughout, okay? But if you feel there are multiple colors in a lesion or a mole, then that's a red flag.
Okay. So अगर even if it's like a gradient-ish color, dyeing color, even then that is okay, but it should not be two different types of colors is what you're saying.
Leave that for your dermatologist to identify. But if you
fine.
feel there are multiple colors, then
Yes,
definitely
okay.
flag it up.
All right. So that's C. D.
Yeah. D stands for diameter. So anything more than 6 millimeter is a red flag. Any mole that is bigger than 6 millimeter in an adult body is a red flag.
Okay. So 6 mm will be something like this,
Yeah.
like half your nail.
Yeah.
Okay.
And E stands for evolution. So if anything is changing, then that's a red flag. And that change could be anything. It could be, change in color. It can be change in symptoms or size, shape, or even, you're having bleeding or pain in that lesion. So that's a red flag as well.
So somebody kind of finds this ABCD, something is wrong. What happens next?
So you definitely need
Yes.
to see a dermatologist,
Yeah.
and you have to ensure the dermatologist you are seeing
Yeah.
is qualified and has actually experience in seeing and diagnosing skin cancer. And when you go to a dermatologist, they usually have this instrument called as dermatoscope, which helps us look under the skin, and we are able to identify features which kind of indicates whether this is a skin cancer or not.
Okay. And suppose, let's say somebody came to you, or you feel that there is a possibility of them having a cancerous mole or spot. What does the treatment look like?
So, the next step would be actually confirmation of the diagnosis. So that would be by taking a small sample, which is called as biopsy, or removal of the whole thing and sending it to the pathology lab for testing. And once we know which type of skin cancer it is and at what stage, we are able to identify what to do next and what will be the next steps of treatment.
Actually, this was my question, right? Stage, most people understand cancers today in India
Yeah.
from stage, stage 1, 2, 3,
Yeah.
4.
Yeah.
क्या एक छोटा सा spot can still be a stage 4 cancer when it comes to skin cancer?
Yes, so melanoma, which is one of the skin cancers, can be lethal, can be very deadly, and it's one of the deadliest cancer known to mankind. So you have to be very careful about such skin cancers, even though rare, but they can be life-threatening.
Okay. Oof. Uh, let's try and diagnose some on air. You know what? Because what is funny and honestly very scary is most people diagnose in India, especially because there's no conversation around it. They diagnose their moles on Reddits and Googles and so on and so forth, right? In fact, what we've done today is we've actually picked up some of these images that people had shared and kind of take your opinion on what it looks like. Okay, so here's the first one that we had.
Yeah, so this is most likely a benign mole, although I will need dermoscopy to confirm it. But as you can see, the ABCD rule, so it's quite symmetrical. Its borders are very clear. There is one single color. It even if it is not, less than 6 mm, then also it's fine. And if it's stable, then I would say it is a benign mole.
Okay, here's the second one. Let's go with this.
Yeah, so this could be a type of skin cancer, a different one called as basal cell skin cancer. It's not life-threatening, but it's also a type of skin cancer and needs to be treated.
इसमें treatment क्या होगा?
So either you cut it out, or sometimes there are creams and cryotherapy or other modalities by which we can treat it. Yeah, this could be a skin cancer, so we'll need to do dermoscopy for this.
What do you suspect here?
So as you can see, there's a larger lesion and there's a smaller lesion. Again, you divide the mole into 4 quadrants. All 4 quadrants are not symmetrical. They are different type of colors. The borders are hazy. And if it's evolving, then, this is a suspicious lesion.
Okay, and here is the last one.
This is definitely a skin cancer. And I would suspect this patient needs removal urgently, even without seeing it under the dermatoscope, I can tell. But definitely dermatoscope will guide you to the right diagnosis. So you can see that if you see the borders, you can see there are these radial streaks, which kind of indicate that the mole is growing, which is kind of an indication of a cancerous mole. There are different colors. You can see light brown, dark brown, and even the purple in the center. So this is also an indication. So again, even if you apply the ABCDE rule, it's asymmetrical. The borders are fuzzy. There are multiple colors. It's a big mole. And if it's evolving, which I think it is, then it's definitely a skin cancer.
Doc, what if it doesn't get the attention, right? So you've seen some of these cases as well. What if people ignore it, or what if people, don't give it the right treatment and attention?
So there are 3 different types of skin cancer commonly present. So one is basal cell carcinoma, the second is squamous cell carcinoma, third is the melanoma. So melanoma is the deadliest cancer known to mankind, as I said before. So that definitely needs attention. Basal cell carcinoma is the commonest cancer in humans, commonest amongst all, but it's not life-threatening. So it will just grow in size, be a bit of nuisance, but would not kill you or harm your health. So, does need attention, but would not kill you. Squamous cell carcinoma sits in the middle, but definitely needs attention. So, anything that you feel, a spot which is not healing, or, something odd on your skin, it definitely needs attention by a qualified dermatologist.
What is so different with melanoma that makes it so dangerous?
So melanoma spreads. It spreads like fire. So it is called as metastatic melanoma. So if it's deep enough, it will spread to your other body parts. See, all the skin cancers are classified on the basis of which skin cell they affect. So it's quite technical, but if it affects basal cells, then it's basal cell carcinoma. If it affects squamous cell, it's squamous cell carcinoma. And if it affects melanocytes, it's melanoma. So melanoma is known to be quite dangerous. And if caught really early, in early stages, all you need is a small skin surgery and you'll be fine. But if it's in the later stages, then it can be life-threatening.
All right, thank you so much. This is exactly why conversations like these are very important. So thank you so much, Dr. Isha. Again, repeating, May is the Skin Cancer Awareness Month. And I think in India especially, we need to have a lot more of these conversations. So my takeaway from today, don't ignore any changing moles. You know the ABCDE rule now. Make sure that you use it. And if you need help, please go to a qualified dermatologist and stop taking your advice from Reddit threads, comments, and Google. Thank you.